Yeah, I feel like too often you hear that people don't go get care because they can't afford care. And so it's excellent to know that they can.
How many young people do we know, or really any age, don't even have health insurance?
Have health insurance.
Yeah,
right.
And they're just kind of rolling the dice every day.
Right.
Because of the high costs and concerns. It is a problem in the country. It truly is.
Good afternoon. I'm Deanne Patina. We're here today with Rick Peltier, with the Executive Director of the Franciscan Health Foundation, and we're on Crossroads Connections podcast. So thank you so much for joining us today, Rick.
It's an honor to be here. I appreciate the invitation. Always nice to see you, my friend.
Yes. So I'm Deanne Patina. I'm the President and CEO of Crossroads Chamber. We are Northwest Indiana's chamber, covering 7 counties, and we connect businesses to businesses. Rick, tell us what the chamber means to you. I know you're a proud board member of the chamber, but how does the chamber help Franciscan Health, the hospital, and tell us about your relationship to the chamber?
Absolutely. I think we've had the pleasure of meeting 8 years ago when I relocated.
That long ago?
Yeah, it feels like just yesterday, right? Time flies. We're also best friends, if you guys can't tell. But
we are.
I was introduced to the chamber very early when I moved here to Northwest Indiana. I'm a transfer, I'll tell you that, but it feels like home, and I love it. Moved here in the summer of 2017. Okay. And then obviously Franciscan already had a strong relationship with the chamber. So I was introduced to that, and then, met you and you came on board as well. Been a strong partner ever since. What has it meant to us? Well, first of all, Franciscan is a very proud legacy sponsor, $10,000 a year. I'm okay to share that because it shows our commitment to the chamber and to improving the lives of local businesses and organizations and partners in the Northwest Indiana communities that we serve. What it means to Franciscan, it's great to be a community partner, obviously. What it means to me personally, in addition to that, it's an honor to serve on the board. We've met some board lifelong friends, first and foremost here. We've built impactful community relationships through the chamber. We've actually been able to recruit some foundation board members on the chamber, as you know, one of those being Chase Loudon. I'm actually using his pen right now. It's like everybody has a Chase Loudon pen. It's the most popular pen in northwestern Indiana, maybe the world for that matter.
If you don't have one, you need to get one.
That's right. Chase will be happy to give them out. How about the shameless plugs for Chase Loudon Financial Services here today? But it's been great. And also generous support. Not only do we support you, the chamber are generous sponsors and supporters of our foundation as well. So it's a two-way street that's incredibly impactful to improving the lives and businesses of everyone here in the community.
Well, Crossroads definitely appreciate your legacy partnership for sure. Franciscan is the presenting sponsor of most of our largest events, our gala, our golf outing, our business expo, and our annual awards dinner. So we truly appreciate the partnership, Rick.
It's our honor.
Awesome. All right. Well, let me ask you a few questions and we'll get started. So sure. Can you give me an overview on Franciscan Health Foundation and how you serve the hospital's mission?
Absolutely. So we are the philanthropic arm of Franciscan Health. We are not a granting foundation, even though there are so many vital granting foundations in our community, like Legacy Foundation, Crown Point Community Foundation are the two most popular here in this area. Also, of course, Unity in the Michigan City area. But we are the hospital's foundation, basically. So our responsibility, my team and I, and it's a team of 5, including myself, is we build those powerful, impactful relationships, what we talked about at the beginning, with game changers in the community who want to help us advance our mission. And we are called to serve the Sisters of St. Francis of Perpetual Adoration. That's who we serve at Franciscan Health. And our mission is continuing Christ's ministry in our Franciscan tradition. I know sometimes people hear that who maybe are not Catholic or religious, and maybe they get a little, scared or confused by that. But please know what it means is, it doesn't matter if you're Catholic, if you're religious, we serve everyone in need. That's really what this mission means. That when you come to us in need, when you are a patient, you are somebody. You're not just patient number 1 in this room. You are Deanne Patina in room 250, and it's our job to provide the most quality, excellent, compassionate care that we can provide. And it doesn't matter who you are or what your status is in the community, what your financial status is, what your background is. We are called to serve everyone, treat everyone with that dignity and respect that everyone deserves.
Excellent. Excellent. I know with the new hospital, you've made some amazing inroads, I'm sure, and impacted several other communities with the hospital being right off 65. And so it's awesome to see the improvements that are made through Franciscan and the commitment that you have to the community.
We're blessed to have that location. You're right. It helps people get to us eat more, a little more easier. It's easier access, right? We got to prevent and knock down those barriers, and access to healthcare is one of those barriers. That's why in the foundation, perfect segue, if you will, that we have a patient assistance fund that helps provide transportation. If you can't get to your medical appointment, you can't get the care that you need, and that's where it all starts. So we can provide a gas card for you for Family Express or Speedway. You name your favorite gas station, and we'll do it. And we also pay for cab rides, Ubers, Lyfts, you name it. So we want everyone to know that transportation or access to the hospital or any of our physician offices or outpatient facilities, that should not be a worry or not a concern. If you cannot afford it or are having trouble, then the foundation will take care of that. And that's one of the ways, again, that you asked in your first question, how do we serve the mission? That's our way that we do it. There's so many funds, and you tell me I can go into some of these right now if that's okay.
Let's do it.
But some of our most popular funds, if you will, patient assistance. So that helps with medication assistance, transportation, Strack and Van Til grocery cards, gas cards we talked about. We've even paid for temporary housing. In fact, there was a patient in the Michigan City area recently. This was around the holidays before Christmas. She was expecting her second child and unfortunately was living in her car. And was too proud to ask for help, but we found that out during one of her visits. So Sister Petra, who oversees our mission services throughout northwestern Indiana, true servant to the mission, of course, and being one of our sisters, immediately called us and said, "What can we do here?" And I said, "What do you need?" And so we provided temporary lodging for her. Our prenatal assistance program visited her at the hotel to make sure she had the care and the resources that she needed. And we also brought food for her through our food insecurity program. So there's a wraparound service right there. Patient assistance, food insecurity, which we address, which is plaguing northwestern Indiana and the country, unfortunately, in the world, and prenatal assistance. So 3 services all in one right there for that particular patient. Many people don't know we have a Center of Hope program, and we call it Hope because we provide hope for, we used to call them victims, but they're survivors of sexual and physical assault or abuse, God forbid, rape, human trafficking as well. We've seen some, unfortunately, we save people from human trafficking who are presented to the hospital. And that's a very powerful program right there. That doesn't make you want to, help somebody and help these children and women who are, abused. I think it's pure evil, quite honestly, but it's our honor to help them and to have this program. And Women's and Children's Services, like our inpatient pediatric program with a partnership with Rotary Children's Hospital. So we're really expanding that at the new hospital. You mentioned the services there. If we can keep more families and children here close to home in their own beds versus, mom and dad sleeping in their own beds versus driving to Chicago or Indy, that's wonderful. And it's been a very impactful program in partnership with Rotary Children's through our NICU. And also now inpatient pediatrics. And please stay tuned because we're going to have more. The plan is to provide more, offer more providers, specialists from Rotary Children's to continue to expand that pediatric care. There really no hospital has that here. And not sure what the reason is, but our job is to take care of what the present situation is and build for the future. So look for more expanded pediatric care going forward. And Rotary Children's is amazing. Top-notch care.
Right. Yes. And so you actually have doctors from Lori's on your staff. So
that's correct.
They're accessible pretty much all the time.
24/7. In fact, the medical director of our NICU, our neonatology, inpatient care center, is intensive care unit. Is a Rotary Children's neonatologist, and he is just phenomenal. And he has brought himself and his team, and they're here. They work on obviously different shifts, like all clinical workers do. But 24/7 neonatologist is there. We have a 20-bed unit, state-of-the-art unit. It's just phenomenal, and the care that is received there, the way that care has grown, medical care. Think about it. Some of these babies are born, they can fit in the palm of our hands. And of course, years ago, the survival rate was very low. Now they said it's almost a 100% survival rate. It's just amazing with what they can do in Lurie Children's. So with our neonatologists, with our Crown Point NICU, which is the most advanced NICU in the region, by the way, it's level 3. The way that these certifications go in healthcare, think of a golf score. So level 1 is the lowest. You want the lowest. Where others, you want to climb to the top. But level 1 is the best. Level 2, maybe Lurie Children's can help us get to level 2. Level 2 is Lurie Children's is a level 2,
Okay.
and in fact possibly in between a level 1 and level 2 because of the most advanced care and what the services they provide there. But we're level 3 status, which is wonderful for a smaller community like Crown Point and the surrounding area. So most advanced NICU in the region, and with our inpatient pediatric program, we have a pediatric hospitalist on staff 24/7, she and her team. So therefore, they are there to assess children when they present to our hospital and the emergency department. And if it's something we can treat here that avoids transport to Chicago, then it's a win for everyone.
Great. Yeah, that was an awesome addition.
Absolutely. We're blessed to have that partnership with Lurie Children's.
For sure. How is the foundation addressing healthcare accessibility for underserved population in the region?
Yeah, and we talked about a lot of that earlier with patient assistance. So we're knocking down those barriers, removing the barriers to healthcare access and affordability. Number one, so access. We talked about the transportation, right? Get you here to the hospital. But not only does the foundation, so we'll help with the medication assistance and the gas cards and grocery cards, as we said, and temporary lodging. But really, our hospital system and the charity care we provide. So when you come to us, and it could be any of us. I mean, who has the money to pay for, a multi-$1,000 medical bill, right? You want to get on a financial plan, a payment plan, number one. And some, based on their current situation, it may take years for them to pay that back. So we write off a lot of that through our charity care program. And what we provide the community through charity care, which includes financial assistance, Medicaid, community health services, education, subsidized health care and services. These are things we provide that's a vital part of our mission, Deanne, that a lot of people don't see because it's not concrete, right? You can't see it. But over the past several years, we have averaged, with everything that I said with charity care, all those buckets that make up charity care, it equates to over $80 million back into the community that we're not charging our most vulnerable patients for health care because that's what we're called to do. It's who we are. And I give you these numbers not to brag because one thing we always say that our marketing team is charged to do, of course, is sharing our stories. But the sisters are very humble, and I respect that. And you very seldom do you hear, Franciscan, offers this. And now we've told them that it's not bragging. We have to get the word out, right? We have to celebrate the services, let them know we are offering world-class pediatric care thanks to Lurie Children. So it's not bragging. It's more letting the community know that we are here for you and sharing that story.
So how do you get the message out to those underserved or, that is it just because they happen to go into the hospital and need service and then they realize other services are available to them, or what's your messaging?
That's a great question. And because we're not, it's not something you think about, right? Putting on a billboard, that charity care that we provide, a lot of it is word of mouth. A lot of people know that due to our mission and our dedication to serving the community, especially those most in need, they know they'll receive that when they come to us. Another way to do that is partnerships through the chamber. If you can help tell our story, and our chamber partners can help tell our story. An opportunity like this today, being on Lakeshore Public Media, this is a vital resource in getting our story out there. But you're absolutely right. Most people will find out when they come and they present to us. But hopefully, if we can do the best we can to tell our story and say, if you're worried about paying for health care, a lot of people are worried about the high cost of health care. I wish there was something we could do about that. But that's why if the foundation can help in any way to offset those concerns, that anxiety, please, my message today would be, if you hear anything, don't worry about that. Come to us. Come to receive the care you need. We are here for you. Everyone matters and will be treated with dignity and respect at Franciscan. And we'll take care of, like I said, a payment plan, or maybe you'll receive 100% charity care. It depends on everybody's respective financial situation. But that's why we have financial planners, caseworkers, social workers there that'll sit down with every patient and help them assess the situation.
Excellent. Yeah, I feel like too often you hear that people don't go get care because they can't afford care. And so it's excellent to know that they can.
How many young people do we know, or really any age, that don't even have health insurance?
Have health insurance.
Yeah,
Right.
and they're just kind of rolling the dice every day.
Right.
Because of the high costs and concerns. It is a problem in the country. It truly is.
Well, we can't solve all the world's problems today, Rick, but we can share the message, right? We can spread the message.
You save one person, you're making a difference, right? Is the old cliche. It truly is.
Yes.
Yeah.
Yes. Can you talk about the partnerships Franciscan Health Foundation has built with the community and how they contribute to achieving your goals?
Yep, and we also kind of addressed this earlier, but happy to continue sharing this.
Yeah,
The partnership with the Chamber has been wonderful. Friendships, I mean, look at you and I, we have that, we know we can joke around because not only are we get down to business when it's serious, right? We partner to make an incredible difference, the Chamber and the Foundation here, and Franciscan, the hospital, and the sisters in the community, but you and I are also friends. We can joke with each other. We are proud supporters. Franciscan is, not the foundation, because again, we're the hospital's philanthropic arm, if you will. So we don't grant gifts, but our generous sponsorship to you guys is through our marketing department, because they know the importance of that partnership. But also you support us with, you sponsored a garden chair in our new hospital in the Healing Garden. That's wonderful. Still sponsorship opportunities. We have one more chair for $2,000. If anybody is interested, we put your name or your company's name right on that chair, very visible in the Healing Garden, as you can attest to. But getting back to the partnerships, also local Rotary Clubs. Honored to serve on your board, also serve on the board of the Crown Point Rotary Club. I'm going to be the president this June to July, so look out.
Do they know what they're in for?
I don't know if they know what they're in for. I know I passed all the tests. Can you believe that? So I guess I have friends there in the right places. But it's just like the Chamber, the Rotary Club, and Rotarians are some of our most generous supporters and sponsors of the new hospital, and with different naming rights and sponsorship opportunities there. Other civic groups, Lions Club is sponsoring a chair. Again, it's partnerships. We can't do this alone. And we talked about our food insecurity program earlier. We partner with the Food Bank of Northwest Indiana. Let's be honest, they wrote the book on battling food insecurity.
Yep.
They help us with our mobile
Chamber
markets. Chamber members as well. That's right, Victor Garcia. Shout out to him and his team. And they also reviewed the space and certified our Fresh Start markets that we have in Crown Point, Hammond, and Michigan City, 3 locations. And what it means is these are basically healthy, certified through the Food Bank of Northwest Indiana food pantries. So you're not just getting, it's healthy food, right? You're not just going in there and getting non-perishable items, which we also offer, but they helped us move to healthier, lower sodium soups and non-perishable items. Most importantly, we have an industrial size refrigerator and freezer. Thanks to generous donors, would not have been able to do that without the support we've received from the community since starting this in 2021. So inside that fridge and freezer, proteins. Think about frozen chicken and protein with fish and different. Why am I having a hard time here? But fish and any kind of meat and chicken, but also fruits and vegetables, right?
Okay.
And so it's a healthy food bodega or food market, if you will, and food pantry. That's very important. And we also have a food prescription program. So when you give somebody food, it's almost like a Band-Aid fix, right? Because what happens when the food runs out? The need is still going to be there. With our Produce RX programs, it helps us get to the heart of food insecurity. Why is that person food insecure? And what health conditions are they experiencing because of that? So now in our EPIC, our electronic medical records, food insecurity is now a diagnosis that we have at Franciscan Health, because if you're food insecure, you're not healthy, it leads to cardiac issues, it leads to a lot of dental issues, right? If you're not eating healthy food and not having the proper dental care, so many issues that we could sit down and that could be a show all into itself. It's just amazing what the general person, you and I were not clinical. I learned this, right, through our providers. I don't know this, but we learn it every day, and it helps us to share our story of why helping us make a difference for food insecure patients is much more than just a handout of food.
So do you do that on certain days, hand out food? Do you do it
We have
different
mobile
times
markets.
a year?
And, certain times throughout the year. Used to do it monthly, and that was phase 1. But since then, we opened our Fresh Start markets.
Okay.
They are open at both locations, or all 3 locations, Crown Point, Hammond, and Michigan City, 2 times each month.
Okay.
And really, it'd be like you or I going to Strack and Van Til or Jewel, right? It's a free shopping experience. Our dedicated, certified social workers who are staffed there through our community health improvement program, And what a name, right? Community Health Improvement. No mystery of what they do, help improve the health of the community, right? And they're wonderful. It's a wonderful team. We partner with them hand in hand. They're like our sister department, if you will. And so they go in, they shop with our team there, the Community Health Improvement team, get the frozen proteins, the fruits and vegetables they need, the non-perishable items. We sit there and walk them through, okay, what kind of food allergies do you have, right? So they're getting what they need. And patients walk away sometimes with 3 or 4 bags of groceries. So that has expanded. That has taken our mobile markets, the handouts, to a new level because they're getting more food. And then they're talking to a real person about their medical issues as well.
Okay. Excellent. Wow. They get a lot. One-stop shop.
One-stop shop, and it's open two times a month, every month. Yep. And you don't need to set up an appointment. You just go there. As long as you have a valid ID, you're going to get the help that you need.
Great. I'm Deanne Patina, President and CEO of Crossroads Chamber, here today with Rick Peltier, the Executive Director of Franciscan Health Foundation. Just talking about
proud chamber members and a board member.
Proud chamber members, right? Board member, we'll get it all in again. So yeah, we're just here today talking about what Franciscan Health Foundation can do for those in need. They do really serve our community well. Are there any innovation projects or new approaches that the foundation is implementing to meet the changing needs of our healthcare?
We talked about earlier how
we could just keep covering
absolutely
it,
how we're not, not braggers, but I am proud to say my job is to share our story, right? Not to brag, to educate and bring awareness, build awareness. We offer world-class cancer care at our Munster facility, our Munster Cancer Center, and of course, the big excitement in the Crown Point and surrounding community is thanks to. Let's be honest. They wrote the book on philanthropy, right? What they've done for this community. Would this community be the same without the Dean and Barbara White family and their family foundation?
Right.
Thanks to the largest gift we've ever received in our foundation's history. We put it out there, and so we can share it again. $30 million. They're going to help us to build the Dean and Barbara White family cancer center on our Crown Point campus. The same location as our new hospital there at 231 and 65. Broke ground last year. You were at that event, I believe, and Craig White was there to share, his vision for his to recognize and continue honoring his parents and their commitment to philanthropy. So that'll open, we hope, next year in 2026. It depends on construction with the weather and if the weather will cooperate. The ground's a little harder right now, as we know, but our goal is 2026. And Ton and Blank, which is another great partner. They're the sisters in Franciscans. Construction company, they build these amazing facilities pretty quick. You talk about skill. It's amazing,
Yes.
I used to just know how to put.
I got to take the
tape
tour
on
of the
things,
hospital and saw how they bring in those full bathrooms already built and things.
Yeah, they build these bathrooms for the patient rooms. It's amazing. On site at their Michigan City location, and then they transport them and then perfectly insert them into the hospital here at Crown Point. They did that for most of the restrooms in the new hospital. It's just amazing to have that talent. I can use a hammer and a screwdriver pretty well, but I don't know if I can do that, Deanne. I don't know.
Yeah.
I can hang a picture if you want that, but I can't build you your own personal bathroom.
That's okay.
Different location.
I got another guy for that.
Yeah,
so
we all have a guy for that. Yeah, we should. Yeah, but so cancer care, and we're excited in 2026 with the Dean and Barbara White Cancer Center coming.
That's great.
Absolutely.
That's great. Mental illness is growing. It's a concern right now nationwide. How is the foundation addressing mental health and wellness in Northwest Indiana?
That's one of those programs we have. By the way, I should say too, take one step back. So the foundation stewards over 100 restricted funds in our Northern Indiana Foundation. So we always say, and I think we'll talk about this a little more in a little bit, but if you have a philanthropic heart, we can find a home for you in the foundation because we have a fund that really gets to the grassroots, if you will, in the heart of everything. And one of those is behavioral health. That is something like we talked about earlier, food insecurity, that it's an issue that's plaguing everyone. Who doesn't need or couldn't use sometimes to talk to somebody, right, and get a mental health checkup, if you will. Mm-hmm. But we're talking about a lot of serious mental health conditions here. We're proud to have been offering very strong mental health services throughout Northwest Indiana, adult and pediatric. And it's all throughout the area, Crown Point, Dyer, Michigan City, Munster, you name it. But our Dyer campus is really the center for all of this with inpatient and outpatient mental health care.
Okay.
And so coming in a couple of years with more changes as we try to stay right competitive with the ever-changing healthcare industry, we are going to be relocating a lot of services from our Dyer campus to Munster, to our Munster hospital. That includes the emergency department, surgery, women's and children's services. So, the OB department there will go to, so women who are delivering right now at Dyer will then deliver at Munster as we are expanding our campus there. If you drive past, you'll see the construction going on, building up 3 stories and then an inpatient tower to be able to provide and house these services, because our Dyer campus then in the next 2 years will become a center of excellence for behavioral health throughout all of northwestern Indiana, and we will expand our services there. The facility there will have more inpatient, outpatient mental health care. And I might say very quickly, we have one of the best kept secrets in the tri-state area, if you will, in the northern Indiana and Illinois, Michigan, that's why I say that. It's called the St. Francis Center. And so this is an inpatient unit that houses boys and girls. We have enough rooms for 15 boys, 15 girls, so 30 altogether, 11 to 18 years old, who are really the victims. And we also say survivors, like we talked earlier about our Center of Hope. But I say victims here because they're victims of circumstances that they did not ask for in their homes. Maybe their parents were incarcerated, drug issues or drug addiction. And so then the children, unfortunately, have a lot of issues, and they're not able to really adjust to society. So we take them in, and it's a court-approved system, and it's part of the state-run program here that we help with, obviously. And the reason why we don't talk about it a lot, because we want to keep the privacy and the safety of these kids. It's a locked unit, but we educate them. They receive their education there, and then there's so many stories, Deanne, of champion stories, if you will, and they are reintroduced into society as a contributing member of society. We help them get their situation under control, and they go on to graduate from college, become the first person in their family to graduate, and go on. And then they come back and they tell their story to the current list of children, if you will, right? I mean, they're teens, really, but they're still children.
Right.
The current crop of children at the St. Francis Center, and they tell their story. And they say they thought they had no hope and they couldn't make it, and look what they're doing, and you can do it too. And that's part of our mental health program, and it's going to be world-class care that we deliver, and we already deliver right here in Northwest Indiana.
That's great. I had no idea.
Yeah.
So for our listeners who want to support the foundation, what are the best ways to get involved, whether through volunteer, donations, advocacy?
Yeah, we said earlier that if you have a philanthropic heart, you can have a home. We know there are many choices too. That's why every nonprofit, look at the chamber, right? I mean, you're only as successful as, look at how many members you have, how many dedicated members. Our chamber is amazing. I can say our chamber because I'm part of it. And the Crossroads chamber is amazing. Lakeshore Public Media is part of that. And, Chuck and Carl's great to see them at the meetings. And we, have built a good friendships as well beyond the business relationships, which is very important. But partnerships and support, you can't be successful without them. Every nonprofit, we're a nonprofit, our foundation, 501c3 status, we would not be successful. Everything we talked about during this program here that we're able to provide, we couldn't do it alone. We couldn't do it without the generous support of our donors. And we call them, donors is the technical term, right? The technical fundraising philanthropic term, but they're really foundation friends. They help make things happen for us. So the way to do that, call us up, visit our website. You can always donate online, franciscanhealthfoundation.org. Make sure you select Northern Indiana. Then you can find a list of all these programs and funds we talked about here. And you have a wide variety. Like I said, we always encourage people, everyone we talk to, pick the program right here. It's in your heart. What difference do you want to make, and what program is closest to your heart? That's the thing. We don't come into a conversation, if you will, with a particular project in mind. We build relationships. We get to know people. We find out what they care about, and then we offer opportunities to make an investment in our mission and to make a difference for those most in need. It's strictly 100% relational. What difference do you want to make, and how can myself and how can I, me and my team help you make that difference?
Excellent. Well, it was great to have you on, Rick, today.
It was an honor to be here. Thank you for letting us share our story.
Excellent. Yep. We'll be here next month again with the Crossroads Connections. Hope you can join us then.